wanted to talk to you about the new classification for PCOS, which is now PMOS. So the Western medical system has finally caught on to what I think naturopathic doctors have known for quite some time, which is that PCOS is not a diagnosis in and of itself. It is a collection of symptoms which mostly have to do with your endocrine system. So PMOS now stands for Polyendocrine Metabolic Ovarian Syndrome. So why did that reclassification happen? PCOS traditionally was diagnosed using standard criteria, which meant oftentimes that you didn't actually have to have polycystic ovaries. So polycystic ovaries were one of the criteria that you could have to get diagnosed with PCOS, but most of the time women were being diagnosed with PCOS just based on testosterone levels, so elevated testosterone, and insulin or blood sugar levels, really, because it should be insulin, but insulin is rarely tested for or used when describing a metabolic disorder. PCOS is essentially being recognized now for what it actually is, which is a metabolic disorder. So what that means is we now have excessive androgen, so testosterone specifically, and we have blood sugar dysregulation, and those two things tend to go hand in hand. So does the treatment of PCOS or PMOS change as a result of this? Well, not traditionally, but naturopathic doctors are going to continue treating it for exactly what we know that it is. So why does androgen excess happen to begin with? And this is really what drives issues with fertility. A lot of patients will be put on birth control, and the reason birth control helps is because it can actually block some of that androgen excess, so those testosterone molecules hormones from being produced. But kind of interestingly, birth control blocks ovulation, and the primary issue with PCOS is that ovulation isn't happening as a result of this androgen excess. So it doesn't work for the way I think that even a lot of physicians think that it does. So how do we actually treat this? Instead of, just reducing the testosterone, what we really have to do is look at the reasons for why this insulin excess or insulin resistance is happening to begin with. A lot of times this is going to be coming from the place of your digestive tract. At this point, I think that that's kind of just really where most conditions are centering from. So it shouldn't be a surprise when I tell you that things are kind of starting in the gut. Not many people think that the bacteria in our digestive tract have a lot to do with blood sugar regulation, but they absolutely do. Our vagus nerve, which is responsible for both parasympathetic and sympathetic activity, so fight or flight and rest and digest. Our vagus nerve is oftentimes very overloaded in chronically stressful bodies, and that means that our pancreas isn't always getting the signals that it needs to produce adequate or normal amounts of insulin. A body that is in fight or flight mode is also going to be usually running off of blood sugar. That means adrenaline and cortisol-based blood sugar spikes. That is going to affect insulin and make it higher than it should be. Once you're insulin resistant, then we start to have issues with our hormones. The reason for this is because elevated insulin will actually suppress sex hormone binding globulin, which is a protein produced by your liver. And that protein kind of like mops up excess androgens. So testosterone in large part will be kind of bound onto sex hormone binding globulin. So it's important when we're looking at lab work that we're really kind of testing all along that feedback loop. What do our adrenals look like? What does insulin look like? What does sex hormone binding globulin look like? What do our liver enzymes look like? So it is, as you can see, called polyendocrine for a reason, because there are a lot of parts of your endocrine system that are inputting for this particular disorder or dysregulation, I think we should probably call it. So how does this affect fertility? The reason why PCOS or PMOS affects fertility is, one, because it blocks ovulation, but I think at this point we've established why ovulation isn't occurring. When you have an excess of androgens or an excess of testosterone, that's actually going to suppress estrogen, because those two kind of oppose each other. So the more testosterone you have, the less estrogen you'll have, the less likelihood you'll have for ovulation. That egg will not mature enough. You can end up with multiple follicles at one time, which is why a lot of times when they do ultrasounds, they will see multiple follicles. But these are eggs that have not released. So most women have multiple follicles that mature on the outside of their ovary, and then in like a blast are kind of released into the fallopian tube. With PCOS, that doesn't happen. That maturation doesn't happen, because that signal from the brain is being blocked by androgen excess. So if we want to reverse PCOS or PMOS, it is entirely doable. It is extremely feasible to restore ovulation if we can get to the root cause of what's going on in your particular body. Inflammation also contributes to what's going on. So we're not just talking about blood sugar regulation from the bacteria in our gut. That is absolutely a part of having this kind of insulin excess. But we are also talking about what's going on in our gut as contributing to an inflammatory picture. So inflammation in our GI tract, but also inflammation systemically in our body. This puts the body in fight or flight mode. This causes the body to produce excess sugars so that we can start to kind of mitigate that inflammation and that damage. Sugars just help our organs to do their job and do them faster. But long-term excess will obviously cause more damage than good. So can we identify places where inflammation is being triggered in the body? Is that just coming from the gut? Is that coming from a place of autoimmunity? There are a lot of different kind of avenues that we need to explore. So PCOS or PMOS is not straightforward for everybody. The symptoms can be very similar, although some people have way worse symptoms than others. The root causes can be very similar as well, but the truth of the matter is all bodies are different and all bodies require a different approach when it comes to a polyendocrine disorder. I feel like you're just not getting the answers that you've been looking for. You are not alone. You and a lot of women have been given this diagnosis, oftentimes really early on in life, and really not given a whole lot of guidance as to what to do about it. And I oftentimes think the educational piece is really missing there. So if you're looking for more information, if you want clarification, if you want to know if the treatment that you're going through is the right step for you, let me know. I would be more than happy to kind of walk through your health history with you and see if there are some parts of your treatment plan that might be missing. And of course, if your goal is to get pregnant, then starting now would be my recommendation. Let's really get all of those things kind of sorted for you. So that you can have the baby that you want and record videos with a baby that makes a lot of noise. So I'm Dr. Arts. Go ahead and check out my website, Naturopathic and Pediatrics.com. Check out my socials, Instagram, Facebook, YouTube. I am so happy that you're here, and Murphy and I would be more than happy to talk to you.